meeting to order. You're welcome to the May Borough Board, Staten Island. Before we begin anything, let's rise and say the pledge of allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. And with CD1 and all council members in hand, we are set with a quorum. Before we begin, just a quick housekeeping note. If I could entertain a motion to accept the minutes from the April meeting that was sent out earlier. Brianna? Thank you. And second? Thank you, Tom. I appreciate it. And with that being out of the way, I'd like to welcome the Department of Health, and we're going to be talking about community health profiles today. Michael, take it away. All right. Welcome.
Yeah, I just wanted to introduce myself. My name is Megan. I recently joined the health department. I'm the new Staten liaison. So if you have any questions or consultancy requests, feel free to reach out to me. I have my attendance cards on the share with you. Thank you.
And I'll make sure your name, email, and phone are included in the minutes as well.
Oh, thank you.
You bet. All right, great, Martha.
Thank you, and I also work at the health department. My name is Martha Alexander. My job is to tell people about the data resources that are available on our website. You know that we produce a lot of data, collect a lot of data, and we make that data available to the public and for folks like you, for elected officials and students and researchers and anyone who might want to use it. So today I'm on tour. I was in Queens yesterday, but to talk about the updates to our community health profiles. Has anyone used them before?
Yes.
Is this like the data set?
This is a online tool. I'll show you, talk about them, but they used to be a booklet. Yeah, are you familiar? Is this ringing a bell? Okay. Okay, so the profiles have been evolving for quite a while. The first issue was in the year 2000. It was kind of just a pamphlet of Xerox, black and white, and then it became a booklet around 2015, 2018. They incorporated a lot more social determinants of health to get kind of a fuller picture of health. And then around 2020, we moved to an online application. The application, you can still print a printed version from the application, and we've gotten a lot of requests for printed versions. So actually Megan's office is like managing the, we'll get some printed copies for everyone. But one of the great advantages of having it online is that the data can be updated piecemeal. You know, like if we get new data from one of our sources, like we have some DOE data, like if we get that new, we can update it in the application then instead of, you can see we were doing it like every 4 years or so before, so it's easier to update the data and hopefully fun to use.
It is.
Yeah, okay. So the reason we made the profiles like this is that there are a lot of inequities in New York City, obviously you know this, but we really see them reflected in health throughout the city. So these two maps showed the, sort of the parallels between poverty rates and premature mortality rates. Poverty, the people living below the poverty threshold, and then premature mortality, these died before age 65. So you can see a lot of overlap between the areas that have the highest poverty rates, highest premature mortality rates, so the darker areas on each map. And just to demonstrate that health is really often determined by our neighborhood, right? Not just our personal choices, but also by the history of discrimination, racism, and the way that our city is built up. So that's why the profiles are developed like this, to sort of give us a broader picture of health. All right. So as I mentioned, it's a web-based application. We can select a community district, compare that with other community districts, and download and print. I'll show you how to do all these things. So you can actually go to the website anytime. It's nyc.gov/health/profiles. I'm actually showing, we're updating the data this month, but it wasn't ready for this presentation. So that's why I'm showing some updated data on the slides, and then I get to sort of talk through how to use it, but I'll demo how to use the software afterwards as well. I find started in the profile. So the first one is to choose a community district. There's a drop-down menu. There's also a map you can hover over, or you can also type in an address, and it will pop up with the right community district. Because a lot of people don't know what community district are. There's a error message that pops up when you're looking at a map sometimes, so you just click that X and X out of it. And then the second step is to choose a section. So there are different sort of sections of the profiles with different topics inside. If there's a plus sign beside it, that means it sort of expands to show different subtopics. So you can see this really walks through the sort of demographics of social determinants of health, about the neighborhood, and then about the healthcare people are able to access and how they're living. We can also print a community health profile. So these are the instructions to print it. These are in your slides, but there are just a few steps to download it and then print it. You could print even just one page also. We tell community members this because it could be, like they might want to bring it to a community district meeting or something, right? But you can also print the whole thing, like one district profile. Okay. Any questions so far?
I remembered this, and I do remember it was like a 4-year database. So I think it's cool that you guys just updated it. So now it could just be like a more year-to-year updated, and almost kind of like a census model too, where it's like it's got the color coordinated graphs and whatnot.
Oh, yeah.
Yeah.
Good. Okay. I'm glad. All right. So just a few. I pulled out a few highlights of data to do some updates about your neighborhoods. And this is not all the data from the profiles. It's just some of it. As I said, I don't know if I said this, but we basically, when we do the analysis of these data, we're looking at how does each district compare to the city average? Is it higher or lower, or not statistically different? So basically, we're able to say something is higher, something is lower. In this case, I just listed the life expectancies for the 3 community districts in Staten Island. No. And then you can see the color coded as well in the map. So you can see that it ranges from a high of 82.1 years in South Beach and Willowbrook, which is higher than the citywide average. And then 2 other cities are lower. I mean, just a little lower. Not a lot of difference. Air quality was one measure where I found that Staten really shines. I think you're talking about the change to DQD. I can see why you're concerned about that. So our Environmental Health Bureau considers the PM 2.5 to be a very harmful kind of pollution. So the NYC average is 6.7 micrograms per cubic meter, and all of the Staten Island neighborhoods are among the lowest in the city with this type of pollution. And the related health outcome then is that child asthma emergency department visits are also pretty low in Staten Island. Talking Great Hills is among the lowest in the city. We know that post-childhood asthma can be exacerbated by like pollution and also household problems like roaches or other dust in the home. And if children are going to the emergency room for their asthma care, it means that they're not getting like consistent care and preventative care. And yeah, exactly. So and the data sources are listed in the application, but I've also put them here. So the life expectancies from our Bureau of Vital Statistics, the air quality is from the Community Air Survey, and the asthma visits are from New York State hospital data.
Those geographies are outdated when you get points that are new information every year, updated the points as well. Correct? Sometimes.
We're working to that model. Yeah.
Okay.
Yeah.
But just,
Yeah, we're updating like all of it in this round, and then up to,
yeah,
and then next we're up. Yeah.
the piecemeal is good. It's just there's so many things you have to add to it.
Yes.
You know,
Yeah.
it's not, you can, just edit
new health commissioner, Dr. Martin, is really committed to making sure that folks can find insurance, stay on insurance, get access to services that they need and that they're entitled to. So that's why I wanted to pull out that fact. And then adults without needed medical care, there's a question on the survey, like, did you go without medical care that you needed in the past 12 months? And about 15% of New Yorkers said yes to that. John Borough rate bills is among the lowest rate in the city for folks going without. So there were fewer people in that neighborhood who went without needed medical care. As far as chronic conditions, is of course can point to the health of a community. Obesity, hypertension, diabetes. So St. George and Stapleton is higher than the citywide rate, 36% of adults are obese compared to 26%. Tocqueville and Great Hills is lower than the citywide rate for hypertension, and 22% compared to 30% citywide average. And as far as diabetes goes, all neighborhoods are similar to the citywide average. We also look at a few school-related facts, because elementary school absenteeism can reflect sort of instability in a family or a neighborhood, and then of course that can lead to making it harder to graduate in the end. But about 34% of New York City students were missed more than 10% of reported school days. So I think it's 19 days that they, if you miss 19 days or more, then you're counted in this measure, absenteeism. So St. George and Stapleton were higher than the citywide average, and other neighborhoods were lower than the citywide average. On-time high school graduation means graduating in 4 years. In New York City, 85% of students do this. Tocqueville and Great Hills is higher than the citywide average, and other neighborhoods were similar. These data are from the DOE. Two other measures we look at are binge drinking and psychiatric hospitalization, which binge drinking can point to like poor health overall, and then psychiatric hospitalization, the rates of that can also, being hospitalized can indicate that they're not getting care, preventive care along the way, or having access to care. So the Staten Borough and the neighborhood rates of binge drinking are going to be similar to the citywide rates. By the way, binge drinking is 5 drinks in one occasion for men and 4 drinks in one occasion for women. That's how the Community Health Survey records that. And then as far as adult psychiatric hospitalizations go, we got a whole range. St. George and Stapleton was higher than the citywide average. South Beach and Willowbrook was similar, and Tocqueville and Great Hills was lower than the citywide average. And to end on a positive note, there's a question on our community health survey: Are your neighbors helpful? Like, do your neighbors help each other? And 58% of New Yorkers, they said, strongly agree or somewhat agree that their neighbors are helpful. So you can see that even the lowest community district, St. George or Stapleton, is still very similar to the citywide average. And Tocqueville and Great Hills and South Beach and Willowbrook are quite a bit higher than the citywide average.
That's positive.
It is very positive, yeah. I think it's pretty cool.
I'm curious too, within that, any metrics regarding, home ownership versus rentals that we may have, transitions for people, the community apartments that they have, that might have a lower percentage in St. George and Staten. The apartment living versus home ownership or something like that.
Right, or, yeah.
But I'm guessing that might have some impact, you help your neighbor, but if you don't know who they are, kind of thing.
Or they've moved in recently,
Right.
yeah,
Right, being in an apartment, and people in the building, but there are a few that I would, say, oh yes, I can help you with that.
Right.
That's probably more along the lines of people who don't live this close to me.
And some people are more neighborly than others.
Yes, exactly.
Yeah, or have more resources to just trust neighbors. In any case, this is a measure. So, now I can show you how to
how the community health surveys are distributed? Like how do you get folks to fill it out?
The community health survey is given, we get about 10,000 responses every year. It's a, what they call it, it's like they send something to your home saying like, they randomly sample by address. So they send it to a home. I got sampled a couple of years ago and I was like famous at my office because they, like my colleagues had never seen that end of it, you know, like the very salient end. So it goes to a home and then it says if you please participate in our health survey, and they ask that the person with the next, like the adult with the next birthday in the home completes a survey. That's a way to kind of randomize within the home. So you go online and log in using the little code from your letter, and then you take the survey online. If you complete the survey, you can get a gift card for $20 or something.
That's cool, so there's some incentive to it.
There's an incentive, yeah.
It's a whole lot more fun than Judy.
It is a really nice, letter to get from the city, and they'll send the letter a couple times if it doesn't, if no one responds. And they work with the vendor to kind of make sure that these are like real addresses, and things. But it is, and then they weight the data according to population estimates from the U.S. Census to make sure that it's representative of all New Yorkers.
Do you find that there's like higher response in certain districts than others?
I don't know that. I don't have that data, sorry, but
That's okay, just out of curiosity.
yeah, it is interesting. I can find out. You can take it online in several different languages. But I always wonder, like, could it be underrepresented people who would never, like, say, ooh, let me take this government survey,
Right.
So.
So we have that out there.
I'm always asking my colleagues who work on the survey, like, tell me this detail. I could listen to it forever. It's really interesting. Yeah, but that community health survey reaches about 10,000 New Yorkers. We do the youth risk behavior survey in high schools, public high schools. That gets about 8,000 high school responses every year in public high schools. And then there's a middle school youth risk behavior survey that's every few years. Those are the big surveys. There are a couple of newer ones too. There's a health opinion poll, and there have been some mental health surveys post-COVID. So those are some of the big surveys we get. And other data sources include our vital statistics, of course, birth certificates, death certificates, and a couple other really interesting data sources a year. HPD, the Housing Preservation Development, does a cool survey. I think it's annually or every 2 years, the Housing and Vacancy Survey. And they get a lot of interesting data, also by race and ethnicity and like nativity, so foreign born or U.S. born. That's a very interesting survey to look at. That's where we get our data on like air conditioning and home maintenance problems. So lots of very interesting. So nyc.gov/health/profiles is the address you would go to access this the profiles online. And I will just zoom out a little bit so you can see more of it. But so community health profiles right here. Step 1 is to choose a community district. So we can click a neighborhood on the map. If you hover over the map, it will pop up with the name of the neighborhood, or you could select from a list. Here, they're listed like by borough, Bronx, Brooklyn, Manhattan, Queens, Staten. And then, or you can enter an address. So I'm open to any of your 3 community districts.
I'll combine it. There we go. So I'm community, where I live is 2, and it's 95 Carnegie Avenue.
Okay. Should we try the address?
Yeah, let's try.
Let's see if it's working. All right. No.
E-G-I-E. My address isn't even there.
Huh?
Oh,
There we go.
There it is.
Yeah, it just takes a minute.
It's okay.
All right. So this is populated with Staten Island 2, South Beach and Willowbrook.
Yeah.
Great. Okay. And then we scroll down and you just select a section. It's a little hard to see here, but some of them have plus signs. So if you click on them, they will sort of expand. So I wanted to show you social economic conditions and economic stress application, the blue bars across the top of the screen are like sections or chapters. There's who we are, social economic conditions, housing and neighborhood conditions. So those are sort of, think of those as like chapters, and then the, below, some of the chapters have subsections or subchapters. So under social economic conditions, there's education, economic stress, etc. So if we scroll down, the great thing about the profiles is they have sort of a text interpretation of what you're looking at, which is great for community members. And then some sort of, like, we're writing the research paper for the students, I guess. Living in high poverty neighborhoods limits healthy options, makes it difficult to access healthcare and resources that promote health. So then we'll have both a text interpretation and a data viz of whatever we're looking at. So in South Beach and Willowbrook, 12% of residents live in poverty compared with 18% of New York City residents.
That's interesting because they have a huge housing complex there. It's a NYCHA.
That's what I was just thinking. Like,
So I'm surprised that it's that low. Very big, right?
But I think there is with two is so broad because it goes from, you actually have two different mansion developments in between. Then
Three.
also, yeah,
It's Berries and Tottenville.
well, and then, but then, no, Toad Hill.
I mean,
Toad Hill, yeah, the Toad Hill. And so it's like, it's just, you also have, this neighborhoods, like when you go down Willowbrook Road East, those are all, where Walgreens is, where Moran, that's a lot of Section 8 over there. Those are all
Right.
voucher buildings, like that's actually called like a voucher community.
Interesting.
So that's why it's very weird to see it so low, because
Yeah.
there are a lot of communities that are just vouchered.
Well, it would be a population
Yeah.
thing too.
Alright.
I wouldn't say it would be anything compared to one, but
Right.
Okay. Yeah. Well, we can see here how South Beach and Willowbrook compares to Staten Island overall, and then the New York City rate is given in sort of rust-colored vertical line. Another cool thing we can do is to add another neighborhood, so a comparison community. So we could look at it compared to one and see. Yeah, you can see that St. George's Stapleton is above the citywide average, quite a bit more than South Beach and Willowbrook. And then, but I did want to show you that unemployment in Staten Island is lower than the citywide average in all three districts. So,
And that's measured by what? Applications for unemployment? Applications for, I mean, how do you know?
so this is from the American Community Survey. Let's see, we do have a,
Because when people drop off the unemployment application, you don't know what happens.
right, so there's a notes page, and there's a link to it down here. So let's see. The notes will be, how do you define these things? Let's see. Data sources.
See, a family that gets social services in, say, St. George, while the family in Grand City doesn't go for social services. They say, well, eventually get a job, or, I don't know. It's hard to frame that.
Right, okay. So actually this, looking at this, we use the Mayor's Office for Economic Opportunity. They have a definition of poverty. So that, I think, looking at that compared to like a national definition of poverty, it's a lot more sensitive. The New York one is a lot more like attuned to how we live here. So this says 2018, 2019, but we have the updated data coming out soon.
That means the income level is very low. 2015 to 2019, right?
So yeah, this, and we see opportunity is the name of the
Oh, okay.
office. Yeah. Okay. We also use these data, we did a report on immigrant health last year, and used these data to look at poverty among immigrants. Yeah. There we go, that's it. We do have these notes as well,
Okay.
and I want to show you one other feature that, in these blue boxes, the last one is called maps, and it's looking at basically everything we just looked at was sort of reverse, so you can just click the X. So we were And you can look at every measure in the profiles just by like rates, sorry. So let's just choose air conditioning. So this will show, the map will show the rates of air conditioning across the city, percentage of households that report having functioning air conditioning. We were looking at South Beach and Willowbrook, so that has this orange circle. But then down here, this is pretty useful. We'll have the highest communities and districts with the highest percentage of air conditioning, with the lowest percentage of air conditioning, and then the numbers by borough and New York City overall. So sometimes this is the top 3, sometimes it's more if the numbers were all the same, but this is often, I think, very useful if you want to know, like, where is it really, which districts have more advantage here.
Which districts are coolest?
Very light.
Good, yes, sorry.
Yeah, yes, and it looks like South Beach and Willowbrook is one of the top of the city, so.
I have a question. I wanted to go back to the survey. Why is it that Catholic schools or private schools are not surveyed? The parents still pay taxes. So why are they not included in the population?
I'm not sure, it's a partnership with the CDC, like the Youth Risk Behavior Survey is done with the CDC.
No, but if you don't give the application to the kids at the schools,
Right,
then you don't take a sampling.
right, I'm just not sure if that was a CDC decision or like I think that's they sample, I'm not sure. I can find out, because I'm not sure, like, across the US, they also don't sample private schools. We are sampling in charter schools, so that's.
Well, that's part of the Department of Education.
Yeah, so, I'm not sure. I mean, the Youth Risk Behavior Survey is about youth risks, so it is a lot of like sex, drugs, and, risky behaviors, so I could see it, public school maybe
They
says, like,
exist.
they exist, but even
Excuse.
with the public schools, our team has to go in and kind of convince some of the principals sometimes, saying that we're collecting this data on a citywide level. The most detail we can give you is like a borough average. We're not collecting data on your one school, how many kids are smoking or whatever. We're not releasing that data because it's not accurate that way. So.
That's a good question.
Yeah, that's interesting.
So you give it to Brooke and then Brooke will share them.
Yes.
Absolutely.
Yeah. Any other questions?
Would it be in, especially like mental health awareness month, is there anything breakdown on mental health in there? Like, is there anything that reflects like maybe, are there certain neighborhoods that have higher mental health issues? And then would you be able to compare 2 different qualities? Like maybe it's air quality or they don't have insurances. God bless you.
Thank you.
Because especially like, that's a big thing that's going on, and especially like we want to look at that, especially at being May, and we're trying to get that awareness out there.
Okay. Yes. We do have, so we have the psychiatric hospitalizations, and we have, avoidable, let's see, that might be the only mental health related indicators. But you could, with any of these measures, you could look at the map and then you could screenshot this map and screenshot the other map and just compare them.
Well, that's right, but there's nothing really with a mental health measure, because that should be something that's really important. I just want to say, only because our neighborhoods, because sometimes you want to see like where it needs the most help. Maybe the surveys that they're not asking, like, do you feel, I know you go to the doctor and they say, hey, how do you feel right now? Do you feel like you want to hurt yourself? Maybe the surveys incorporate that, because there's a lot of people that don't have the money to go to the doctor to even say that.
Right. Yeah, we do have, there has been a few mental health, there was a mental health report that came out last year. Did you see that? Okay. They, I don't, have you, I'm sure you can go on the new NYC website. This has been pretty good for searching. a search on the health department website, it just takes you to this, to the city. Yes. State of mental health in New Yorkers. So this report had a lot of, it was based, pulled from a lot of different sources, including I think a survey that they did for this report. We can send you this link to your, but
It's just something that's put out there now, especially for the campaign and
with the,
May's not the whole awareness,
Yes,
so,
right.
yes, it's right, like I wanted to update my website with because I noticed that even the city one didn't have it, so I don't know.
yeah,
That's a great resource.
yeah, they really pulled together a lot of information really quickly. Our previous commissioner was like very mental health focused, so, which is great, that was during his tenure. Anything else that you'd like to see or find?
Is some of this, like the mental health issues, shared with the NYPD? Because we find that there's a crime related to mental health issues.
I'm not sure how much the health department talks to them.
Maybe the, health, mental health issues regarding the.
Communities and related to crime. Because it seems to be, when there are reports of serious crime, this individual who commits the crime has mental health issues dating back. But this is not the purpose.
I guess we need that, like, touch base with the PD and,
I'm not sure how they get their data on mental health.
I think it's after the fact.
I see what you're saying, yeah.
Still maybe a useful outreach to, talk about the community on the profiles and specifically about mental health. These things that we have here, we can share this with them. But, how they interpret it, what they do with it,
Right.
note that. But the correlations there is worth thinking about. This is really interesting. Thank you guys so much.
Good. Okay, thank you for,
And I would imagine coming through all the data, trying to make it, sensible and useful and compact, that's quite a challenge.
yeah, it is.
thank you for the opportunities.
Yeah,
Thank you for coming.
yeah, really, I mean, the purpose is to share it with folks, right, so, yeah.
Any questions from you?
It's just like one last thing. You mentioned HPD or databases. Do you guys, is that something, do you create the databases with like the HPD categories? Or like is that completely different and it's in HPD's realms?
I think they analyze their own data. Yeah. And we ask, we tell them exactly what we want, and we'll send us the numbers.
Oh, but you still put it together?
I mean, we might ask for the, I'm not sure if you know the.
Integrated with this
Yeah,
information.
and for example, if I was to be on this website and I was curious about agencies in a particular district, does that show up here?
Yes, yeah, yeah, a lot of things we're looking at are different sources.
Oh, vacancies too.
What do we have this, homes with maintenance problems or no maintenance problems, really? So, Staten is doing great again here, and then, also doing great on cockroaches, so. Yeah, these are both from that survey. I don't, where, 3% of households see cockroaches?
That sounds about right. A lot of rats, a lot of rat-related issues.
So good to see you.
Great, well, thank you both so much for your travel over, and we really appreciate the information.
Thank you for hosting, I appreciate it.
Nice to meet you.
Likewise.
So are you gonna hop the train to get back home? Get back to
Ferry,
your
ferry,
Oh, the ferry, I meant.
Ferry,
Yeah, sure.
Yes,
Local
I live
transportation.
at the other end of Manhattan, so,
Okay.
yeah.
You have a dream?
I do have a dream, it's fine.
I'm glad the weather, the rain stopped.
Yeah,
Yes,
like you said, it really is a beautiful trip, so.
Yeah.
Happy to come out.
seriously, it's one of the best in the city. Great.
Yeah.
Well,
Thank
then
you so
everyone
much.
else. We did not have any correspondence this month. Any old business? Any new business? So far, I'm not aware of any presentations for June, so it may be virtual. If that changes, I will let you know. Okay?
Sounds good.
Last but not least, can I entertain a motion to adjourn the meeting, please? Second? You are second. Oh, that's right, thank you.